Hi, everyone. Welcome. My name is Blair Embry. I am the Marketing and Communications Manager for Prison Yoga Project, and we are really looking forward to exploring trauma-adapted yoga and forensic psychiatric care today with everyone here. Thank you so much for joining. I'm going to introduce our incredible facilitators that we have here with us today. We have Nora Kakaris. Nora is a professor of medical science and associate professor of experimental forensic psychiatric research. She also has a PhD in neuroscience research. Her teaching philosophy is rooted in a holistic perspective where the unique individual is at the heart of a dynamic and continuously changing the world of mutual learning. She believes that altering behaviors by changing the brain may not necessarily require pharmaceuticals or invasive therapies. She leads I had to look up how to say this. I'm really sorry. Yeah, Nora, come in, please.
Epidemiological.
Yes, thank you so much. It's the neurodivergence. It's not always mentioned. Studies investigating the impact of our social environment and clinical studies examining the effects of biological interventions such as yoga and acupuncture on health, behaviors, and resilience. Thanks so much for the help, Nora. Welcome. Our incredible next guest that we have today is Josephine Wickstrom. Josephine is an ERYT 500. Certified in trauma centers, trauma-sensitive yoga, yoga therapy for the mind, and many more certifications. She has been introducing yoga and dance to Swedish prisons since 2008 and focusing on yoga for trauma-exposed populations since 2003. She coordinates European training for the Prison Yoga Project and teaches programs in Mumbai, India, and Mexico. Josephine co-developed the Swedish Krim Yoga program and is developing national trauma-informed yoga programs for Swedish forensic psychiatric units, the juvenile justice system, and schools. Trained at the Minded Institute in London, she specializes in complex trauma and mental health. She completed the Traumatic Stress Study certification at the Trauma Center for Boston and the Global Mental Health Trauma and Resilience Certificate from Harvard Medical School. Everyone, please welcome Josephine. And last but not least is our fearless leader, Nicole Healthaller. Nicole is the executive director of Prison Yoga Project, is a graduate of the University of Arkansas's Clinton School of Public Service, and is a certified yoga teacher. While originally from Connecticut, she lives in and has lived in Arkansas since 2014. Previously, Nicole worked as a high school educator for Teach for America, where she studied and implemented trauma-informed responses to misbehavior to help her students achieve their goals. She also studied and worked in Cape Town, South Africa, supporting yoga instructors with children with autism, and in Vietnam, where she taught teachers how to use trauma-informed techniques to improve classroom management. Nicole has a passion for social justice, prison reform, and yoga, all rooted in her desire for restorative and transformative justice as an alternative to punishment and its harmful effects. In addition to her role as executive director of Prison Yoga Project, she facilitates yoga at her local jails and Little Rock for youth and adults. Everyone, please welcome Nicole. Well, that was certainly a mouthful. Everyone on this call is so educated, such an incredible opportunity to have everyone in this room, and just has so much experience in the work that we do here at Prison Yoga Project. So without further delay, we're going to invite Josephine in to do a centering opportunity for us, and then we'll continue into dialogue. Welcome, Josephine. Thank you.
Thank you so much, Blair. So happy to be here. Thank you for this invitation as well. Okay, everyone, I thought to invite you into this centering opportunity today with some movements, picking up on the energy from the chat box. So here you can try to find a seat on your chair, or you can also choose to stand up if that's more available for you today. I'm placing my seat at the edge of the chair and I'm connecting my feet to the floor. Okay, I'm just taking a moment to notice where my seat is. Maybe you had a long day already, or maybe you're starting your day. And everything I'm kind of guiding here is an invitation. So when you're ready, you can try rolling your shoulders up towards your ears and down the back, and just acknowledging that Our shoulders around the planet normally need some attention, depending on, it doesn't matter where we are. See if you can release some tension, and then you can move one shoulder, the other shoulder. And if you want to skip out and just have a seat and relax, that's also a possibility. And in your own time, you might want to explore the air around you. You can sweep your arms as far as it feels okay for your shoulders, and maybe try to create some space around you. You can also look at your fingers, your hands when they are moving. Depending where you are in space, the movement might be small or large. It might be slow or fast. If you want to bring some breathing into this, you can try maybe inhaling on the way up and exhaling on the way down. You can try this one more time. And the next time I'm reaching up, I'm going to add a movement, and you can follow if you want. I'm going to do a little side stretch to start to notice the side of my body. The arm can be over the head, or it can be shoulder height. You can try different variation with your arms. Today I'm going to rock a little bit. I need some movement in my body. And when you're ready, you can come up. Maybe a shoulder roll in between. You can also shake a little thing. Shake your arms, shake your shoulders. And we do say these things, right? Shake things off. Shake things off for a little bit. Okay, and then you can try the other arm. And see where this arm want to go, high or low. And maybe you can feel a stretch into the side of the chest, into the back. And then releasing towards the center. And again, you just move your shoulders. You can shrug your shoulders or roll your shoulders. Right, and we call this the arrival sequence when we have been facilitating this as well inside the forensic psychiatry to connect very clear sensations. So this is the rubbing sensations in between your hands. Perhaps you can connect with the heat created in your hands. And then you can try, again, see if you can create some space around you with your arms. Another option might be to give some slight pressure into your hands, a little massage into your hands to get into the feeling of the hands. Okay, and then taking this a little bit further with the hands and the shoulders. So I'm bringing my arms up, and in your own time, you can try interlacing the hands. And while engaging the hands forward, I'm rounding the back. So I'm reaching those areas that might hold some tension. And then coming up, and then releasing the shoulders. That felt okay. You can try doing it again, just noticing where I'm breathing and moving together. And I'm going to inhale when I'm lifting my arms up, and then I'm exhaling through my mouth with a long sigh. And then I'm releasing again. And then just a few moments settling in. You choose if you want to have your eyes open or closed. And if you have a lot going on today, maybe you had a stressful day, then you can try exhaling a bit longer, maybe inhaling to your nose, exhaling to your mouth. And if you feel more like working with the balance, you can inhale and exhale equal length. Just for another minute. And when you feel ready now, you can start to slightly open your eyes and orientate yourself in the room. We look around a little bit and then find a pose of your choice to keep your focus during the next hour or so.
Thank you so much, Josephine. That brought me back to February when we were together practicing in person. I was so lucky to be with you in the UK for our HMPPS training. And it just dawns on me to also thank you because I've incorporated a lot of what you just did with us in the jail in Little Rock. And it's been really, really fun and participants have really enjoyed it. So we're going to kick off talking about y'all's study. And we want folks in the audience to know that some of us are very scientific and might get really excited about new studies. We also understand that maybe this is a different area for folks. And so we're going to try to really balance it out with information that it's easy to digest for everybody about the study. But before we jump into what y'all conducted, what y'all found, I think it's really important for our community to know more about the folks that you were serving in this study. So Josephine, if you want to tell us a little bit about this population, that would be great to start us off.
Now you can hear me? Yeah. Okay, so absolutely. So for those of you who don't know what forensic psychiatry is, that is where you go if you've been sentenced to be too mentally ill at the moment where you committed the crime to actually go to a prison. So you can have committed a crime during a psychotic episode, or it can be also other diagnoses involved when you have committed a crime. And also the court they do a truly like a real, how do you say? Nora will help me with my English, but they really do an
medical investigation.
Yeah,
it's a
exactly.
Psychiatric medical investigation. Every time where it's we suspect that the client or the person cannot be responsible for the act of the crime, then they will be sentenced for forensic psychiatric care, which is a prison environment, but continuously offering psychiatric care.
And you can also be sentenced to a prison, and then after a while, the prison administration notices that you are actually too ill to be inside a prison psychiatric unit as well, and then you can get sent to the forensic psychiatry. And there we meet a lot of, we call them patients there, so we meet a lot of patients, and it's also mixed, which is pretty unique. You have both women and men in many of the units together. And that made this research an extra layer of complexity, right? It's complex to have both female and male inside the same yoga classes. So that was difficult and not really trauma-informed. So we had to kind of adapt, as we've been using that word all the time, right? And also it's more like a hospital environment, even though it's behind bars. So that's the difference between a prison and a forensic psychiatry. But yeah, some people spend a really long time inside these hospitals. Like that's where we have like Swedish life sentence people.
I was going to ask you that. Oh, go ahead, Nora.
Yeah, no, I think that's important that you don't get sentenced for a defined time, but you are sentenced until the psychiatric clinic certifies that you can enter the society. So most of the people sentenced to forensic psychiatry are lifetime or very, very long time serving here.
And they will also see patients that get the care that they need and they get back into more stability and they do re-enter the society with better means and getting by with the right support systems as well. So there is a positive, but it's also like a negative inside these systems. It's a very hard system to work within, both for staff and anyone actually who enters these facilities.
It sounds like it. And to my understanding, they're also a very heavily medicated population, correct?
Yeah. So that is another layer you have to kind of take into consideration when you're facilitating yoga as well, that all of them are medicated and they also need to be under medication for a certain amount of time before they can enter the yoga program. So they need to be more stable and more in balance before they can enter any activities that are going towards rehabilitation.
And that's, I think, also really helpful for our community, because I'm not in any sort of forensic psychiatry unit in my program, but there are a lot of people that are on very high levels of medication, whether they're withdrawing from substance use or anything like that. And so what we learned from you today, I think, can be applied even to the general population in many ways, even though this is a very specific population with a very specific sequence, which takes me into my next question, which is, how did you go about facilitating this class? What did the class look like? What poses did you focus on? For those in the room, help us understand what it looked like day to day.
Okay, so first, to start with, this was not an easy task to actually create a sequence that would be adapted into each of the units in Sweden inside the forensic psychiatry, with all of this going on: schizophrenia, psychosis, severe PTSD, and highly medicated patients. And also we had the mix of male and female. So we had to think about all of these aspects while creating this sequence, right? So actually it started inside the psychiatric unit in the max security prison for men where I'm teaching. It's a similar kind of setup with the diagnosis, even though they are not as heavily medicated as in the forensic psychiatry. So we started to develop this sequence together with the guys. And while doing this, I also really researched and went back through all my training, contraindications for psychosis and schizophrenia, what we did need to think about, how to sequence in a classroom where you have maybe possibly a man behind a woman, or, like we're trying to make a circle, but anyhow, it can be more vulnerable when we are in a mixed class. And then again, also, we wanted to look into like breathing practices that have some research behind it, with no contraindications for these kind of folks that we are serving. And then again, we wanted also beneficial practices like balancing practices. And we wanted all of this releasing the tension chain from stress. Also, maximizing the benefits and minimizing the harm. So we used it for a while inside the max security prison, and then we tried it in the forensic psychiatry for like a year. And then the feedback came back from the patients in the forensic psychiatry, and we redid it. We went back again for another year. The staff tried it, and then it came back again. So it's been like back and forwards with a collaboration, national collaboration, to make this the best ever sequence we can to, fit those who are really hyper aroused as well, and those who are strongly dissociating and having a hard time getting going and a lot of medication. And so how can we make a balanced practice like that? So yeah, it's been a really long journey of discovery, actually, and it really taught us a lot. And it's our colleague Eva Seilitz. She was the one who initiated this program from the beginning, and then me and Norva got involved, and I got involved in developing the research program as well. But we actually found a formula that suited not all but most. So we had a really low dropout rate, actually, and that shows us that this formula can possibly work for a few, but not all. So it's like we need to be really humble in front of the complexity as well.
Thank you. And I don't think I realized going into this how much the methodology or the sequence or the program, however you want to describe it, was tested prior to this study. And I appreciate so much how much input was put in by the participants themselves and the staff, as that's what we really try to make a part of Prison Yoga Project, is what do they want to do and what feels good for them and their body. Can you, Josephine, elaborate a little bit on what you mentioned that you did some research around things that may be contraindicated for that population. So what are some things you avoided in the sequence that was helpful to them?
So, comparing this class to a so-called normal trauma-informed, we chose to call it trauma-adapted to kind of make a difference in between the two methods, were that too much guidance towards interoception. That is one point that we noticed that was really triggering, because some of the folks, they couldn't feel it at all, and some felt too much, right? So noticing your sensations in your body. So avoiding to kind of flowery descriptions, and to being more clear and straight to the point, because I really felt that it created more insecurity and more confusion the more interoception we added. So we just had some really clear cues. Can you feel the pressure in your hands, the friction between your hands? Maybe you can feel a stretch in the side of the chest, but that's it. Like, not too many cues, because it can be too many layers, right? If we're asking them to mirror someone practicing yoga, listening to an instruction, and then they're going to feel the body. And if we give too many cues, that can be like an overwhelm, right? So keeping it simple and as clear as we could. So that was one of the cues. And then also keeping kind of a rhythm in the class, because we noticed if it was too slow, people were starting to dissociate and we kind of lost them. It was hard to get them back. And for those who were hyper anxious, they had a really hard time to kind of come down again, because those loops in their mind went off into a spin. And then also we did very clear, like we did for the relaxation, that's where many triggers came up. We did more like a progressive muscle relaxation. Again, you have something to do with your body that's more kind of practical, not just like feel your hand, just really giving them something, hands-on to do while doing the relaxation. So there's quite a few layers and of course, avoiding, fast-paced breathing and all of these practices that can really trigger a nervous system like that. But we noticed as well, and this was a huge difference actually from teaching so-called open trauma-informed classes, that we can bring the rhythm and the pulse of the heart up to a point. Then people were starting to have a little bit of an issue with the pulse raise. So the pulse could come up, and then we had to kind of modulate as well, like how many places in the class we want to raise the heartbeat, and we want to lower the heartbeat for the heart rate variability to work with the autonomic nervous system. But again, we had to keep it very contained. Still rhythmical and still during the class, but kind of not spinning off in too fast sequences, so kind of keeping it more contained. We don't do that in normal trauma-informed yoga either, but here it was really more contained and really training the staff. And here it was necessary to have highly trained medical staff that are used to work with these patients and already have that relationship established, because that was the safe container. Even though they are not trained yoga teachers from the beginning, but they had all of that professional knowledge and also that kind of knowledge about their patients. And if the trigger would come up, they also learned from us how to work with the body to reduce triggers or kind of give methods to self-regulate. Now I talked a lot.
No, that is exactly what I was looking for, to paint a picture of what it both does and doesn't look like. And I think one other thing I've heard you mention in the past about folks that are heavily medicated is being really careful about going upside down, right? And forward, anything really that's going to fluctuate the heart rate in a way that is too much. So I hear veering away from extremes. And if you're listening to this later in our podcast form, we're talking about modulating our fingers going up and down, right? But in this class, it's going up and down a little less. We're staying within a smaller window of tolerance for folks. Thanks for also explaining why y'all chose trauma adapted versus trauma informed. I think it can get confusing out in the world of, what do you mean trauma informed, trauma this, trauma that? We typically use the term trauma informed for our programming, and it makes a ton of sense why y'all chose trauma adapted specifically for this group. And I know Prison Yoga Project is adopting this terminology as well, working with forensic psychiatry patients. Yeah.
I can add something to that as well, because there's more layers of adaptation. And me and Nora we've been kind of developing programs for different units and different sides of the healthcare system as well. So when we're working inside the forensic psychiatry, we are adapting the yoga classes and the trainings for that environment, because that's a unique environment, right? And also what do we add on for those staff, the healthcare staff? And also the extra layer of that is the benefits and the adaptation for the staff, the environment, and for the patients. So it's like a whole chain of adaptations that kind of really targeting these kind of people. And then we're working inside the youth and child and adolescent psychiatric care. Then we have another approach because there they can leave the environment, that they are not confined, and there's so many different layers of how we work differently. So then it's adapted towards those needs. So it's specifically adapted for the healthcare systems, you would say.
Yeah, that makes a lot of sense. And I think what's really important to call out in what you just shared is it's not just that the yoga itself is adapted, but it's the context in which they are living that's adapted, right? You're working with the staff for them to adapt the way they are interacting with the folks that they're serving. And that's really important too. So Nora, we completed this study. Can you share? Well, I know I say completed. That's with an asterisk because I know there's more to come. But can you tell us about the results that y'all were able to come across?
Yes, we have published the first results after 1 year of data collection, and we continued data collection 1 more year. So now I present, I actually 2 days ago, I already know the final results, and I can say that it's not that different from what we published, which is good. What we measured, it was based as well our experience from the prison yoga studies, because with Josephine and Eva Scheilitz, we have led one of the world's still biggest randomized clinical trial within prison environment in 2013 to 15, and these data and analyses are published 2016, 17, and 18. So we do know that what works with prison population. So we chose specific measures to focus when we went to the forensic psychiatry. And these measures were, the first one is aggression and antisocial behavior, because of course we are speaking of criminals or people who have committed criminal act. So it is an important measure to see if their aggressive and antisocial behavior is changing through this treatment. Then we were looking for psychiatric health, self-reported psychiatric conditions, and that was measured by using so-called psychological distress measure, which measures different aspects of psychiatric distress, like what you know, like anxiety, depression, hostility, phobic anxiety, psychotic ideations. So that was a nice measure to capture quite a wide range of psychiatric conditions, but still self-reports. Then we measured and we seen significant effect of yoga within the prison environment in affect, positive and negative affect states. So those who engaged in yoga, they have a significant increase of positive affects, positive emotions, and mainly those so-called low arousal positive emotions like feeling calm, serene, safe. And at the same time, they show a significant decrease of negative emotions, both which is coupled for the sympathetic nervous system, like being angry and hostile, and the low arousal, so coupled to the parasympathetic nervous system and being shame or depressed, down. Okay, so I said aggression, psychological distress. We measured emotional states, and we measured as well, which was unique, and still we are very unique in the prison. We measured personality. And who would think that why would your personality change with 10 weeks yoga? And we are not stating that your personality is changing. However, we were able to prove it, that 10 weeks yoga within the prison population coupled to one aspect in our personality, which is called the character maturity. So those persons who participated in yoga, they had an increased character maturity, which character maturity is reflex for self-control, emotional and behavioral control, taking responsibility, thinking of consequences. And this was a very, very important measure, I believed, as a neuroscientist, because by changing the control of your personality, it reflects neurobiological changes, showing that you are increasing control of your behavior and emotional states. So these measures we picked and put it in the forensic psychiatry study as well, and completed with something more. And these were measuring somatic pain, because we are coming to more psychiatric conditions, and we do know that patients with psychiatric condition they do feel more somatic pain. So we wanted to measure that one as well, and we wanted to measure craving, because a big proportion of this psychiatric population have substance use related syndrome. And of course, it would be a very important biological measure of the impact of the in their substance or addiction or substance use behavior. So this was the measure which we were used. What was the change compared to prison yoga study is that, as I said, the prison yoga study was a randomized control trial, which is the highest evidence level within science, what you can do. And that means that in the prison, the inmates could choose if they want to do, if they are coming to yoga, and they couldn't choose if they will do yoga or they will waiting for the yoga class. So my control group actually existed of people who wanted to do yoga, so their motivation was the same, but they had to wait. This was the difference, as these persons or patients in the forensic psychiatry are suffering of severe mental illnesses and heavily medicated. So we couldn't expect that if they want to do yoga, we would say to them like, okay, you are not lucky. You have to wait 10 weeks before you start yoga. We would lose a lot of patients participating. So what we did, it's so-called quasi-experimental study design, which is the patient itself chooses. If I want to do yoga, everybody had the possibility to do yoga classes right away, while our comparison group existed of patients who were not interested in doing yoga. Then we measured all of these aspects of behavior and personality and psychiatric health and somatic health, if you think about pain, before they came into the study, into the treatment, and then 10 weeks later. So it was a 10-week intervention. Twice a week, they were offered to join the yoga classes, but to the inclusion, to the evaluation of yoga effect, we used that they had to be at least once a week in the classes. So it was comparable with the criminal ward, with the prison yoga study, which was once a week during 10 weeks yoga classes. I stop here so you can ask me what was the result, because I can increase here the waiting for this one. But before I forget, I want to say something what I always tell of my students as well, that I am a scientist who is working with quantitative measures, so I'm speaking about significant results. And when we are speaking about significant, like I said, like in the prison yoga study, we had significant changes. It's very important that you understand that significance in this context does not mean big. Okay? Significance, it means that we are sure that the changes, what we are measuring, are caused by the treatment, in that case, yoga, and not by chance. Okay? So when I'm speaking about significant results, it means that we are sure that it is yoga's effect and not caused by chance. But it doesn't mean anything about the level of the change. Is it a big change, big difference or not?
Thanks, Nora. I was going to ask that, so you already got ahead of it and explained. Josephine, what were you going to share?
I can just add something, that the classes were 45 minutes long. It included all of the important aspects of our methodology within the PYP as well, breathing practices, mindful awareness, movement, and relaxation. So we had all of those aspects, just that we adapted them even more.
Yep. And then y'all took psychological measures, as Nora described, to see what was the effect, testing for statistical significance, or how likely is it that this result came from yoga as opposed to something different, right? We can say yoga helped in this area. So Nora, take it away. What did we find based on your research?
I will start with that one, which was surprised that we didn't find any change. And these were two things. And this is actually aggression and antisocial behavior. We didn't see actually any impact of yoga in this aspect. And we didn't find any change on craving as well. And when I did the analysis, it was like, oh, damn, it was a bad study. But then I realized what was the problem. And that's what you both spoke about, that it is a very heavily medicated population. So there is no aggressive behavior. When I looked at the start of the aggressive behavior, it was 0, 0, 0. So they couldn't quantify their aggressive or antisocial behavior, and they haven't had any craving neither because they were medicated. So that's why we couldn't change, or we couldn't measure any impact of yoga in these aspects. Which is important to say, because we did measure these changes in the prison population. What we could measure in the forensic psychiatric population as well were significant changes. Okay, so I'm sure that it's yoga's effect within the negative emotional states, but not in the positive. So their negative emotional states decreased, being angry or hostile, and being depressed or down. All of these states significantly decreased with a big effect size. And when I'm speaking about effect size, it means there is a big change. Okay, while there was no change in the comparison group in this measure, we have seen within psychological distress, so their psychological health or psychiatric health, the significant changes we could measure within anxiety, hostility, interpersonal sensitivity, paranoid thoughts, and phobic anxiety. So from these ones, if you think about the phobic anxiety, which is mainly being closed in a small environment, so we are measuring agoraphobia, so being closed in somewhere, it changed significantly. Paranoid thoughts, it's very important. We have a lot of paranoid patients and schizophrenia, psychotic conditions. And also the significant decrease of hostility, which is their report. So even if we couldn't measure in aggressive behavior, their hostility, what they have reported, have significantly changed. And none of these changes were measured in the comparison group. So those patients who got the care as usual. Pain, it was a new measure to look at. And what we saw is the frequency and the intensity, both of them changed in the yoga group, while the intensity actually increased. Pain intensity increased in the comparison group. So this was one of the measures when we compared. It was a very high significance, high difference, big difference between the two groups. So definitely the somatic pain impacted by the yoga. And then I'm coming to the top result, which was, I was the most surprised again, that actually we did measure significant changes in this character domain, which is the self-directedness. So only those ones who participated in the yoga had an increase, significant and large increase in their character maturity, which represented taking control of their emotions and behavior and taking responsibility for their acts. So these are the results.
Thank you. That was a beautiful description. And I know that is not easy to run through all of the outcomes. I think it's really important to sit with the fact that there was less pain in this group and that it was specifically yoga, like not another type of exercise, right? Because I think often when we approach correctional facilities or other institutions about the work we do, it's like, yeah, we want some healthy exercise. And it's like, sure, that's a component of what we do, but there's many other aspects. Yeah, go ahead, Nora.
It's good that you say, because I missed to say that one, that our comparison group, it's important that they are doing at least once a week the same amount of like 45 minutes, 50 minutes of physical activity, and it's recorded as well. So we could control that these people who were in the comparison group were not passive people. So actually it is yoga and not any type of physical activity.
Absolutely. And not to say that physical activity is bad, but simply that this specific approach, the way that yoga was taught, had a very positive impact. Josephine, it looks like you have.
Yeah, I always feel this when we're talking about this, that sometimes it's easy to get like, oh, it's only yoga, but I'm always thinking, both. What happens if we can couple them both? I mean, it's such a maximize the benefits, right? To have this regular exercise, regular yoga throughout the week. So yeah.
I mean, as someone who has Bollywood danced with you, I can't agree more. And so I think just calling out the intention behind the movement, right? So it's really good that we're moving, but in all the ways you described that folks move, where we're being mindful of heart rate variability, we're being mindful of not people going outside of their window of tolerance, of not being too aroused or minimally aroused. All of those factors were really important. And so based on this, our sort of last big question is, where are we going next with this information? And so just to give an example on our end, we are thrilled to receive this research and honored that y'all are sharing it with us now. I know here in the States, we're going to be working with mental health staff at San Quentin and training them in a very similar methodology to work with their participants in their forensic psychiatry units. And so I'm curious what the next steps are, Nora, both for the research, but Josephine, also for you personally.
I just mentioned that I did the results of the final data, which is not published, and this one, what I spoke about, unfortunately, we could only analyze male patients' data because female patients were not comparably divided between the comparison group and the yoga group. But now in the final study, we got in some more data, and actually research plan is, as in the male population, we get the same results. So I don't feel it's important to redo the analysis, but I will do the analysis only for those few women who participated. We are speaking about 12 or 15 women. What we are seeing that they are not that strongly responding to yoga, not in pain sensation, not all the aspect of psychological distress. So my next year research will focus on this one to give guide to Josephine how to develop specific treatment for yoga for female patients to try to find the explanation. So I will do the analysis first and then try to hypothesize and find an explanation. Why is it that female didn't respond so well? If I can say, still we find a positive impact, but not close to how male patients responded.
And I would really like to investigate, the impact of these women who are the most trauma-exposed women in Sweden, who are coupled with the most severe, also traumatized, of course, but perpetrators, right, in the same group, which is, of course, not bringing them into a relaxation. So it would be really interesting to hear their personal responses. What happens, because this is something we have strongly argued from the beginning, to separate men and women in the yoga classes, but they were not able to do that. And they are in other activities together, but I'm sure that must be a massive impact.
Yeah. I imagine I am here in the youth facility that I've provided yoga for. They also are mixed classes, and there will be days when it's boys and girls together, and then days where it's just girls or just boys. And the amount of relationship building that happens when it is just that female population is so different than when everybody is there. And so I can only imagine that there's so many layers to their feelings of safety. And I'm really proud to know that's something y'all are going to study further, because maybe they will allow for them to practice separately from each other.
And we do have data about the experiences. So we have did actually interviews with the patients, which are now analyzed and probably hopefully are coming out during this year as scientific publication. And what is interesting as well, that the first time we actually interviewed the facilitators and the personnel in these clinics, like the chief, the boss, what is changed, or those people who are working with patients, who they experience, what the patients change and what their working environment. Because we do believe that, and we know actually, even if it's not published yet, that it has a very strong positive impact on the nursing staff in this case, or their mental health and working environment, so working conditions to work with the patients with yoga.
And here's Blair back to invite the rest of the community in.
Yeah. Hey, everyone. Thank you both so much. And thank you, Nicole, for leading this incredible conversation. So I dropped it into the chat, but now is the time where we're going to transition into some questions and answers. And I have a couple that I'll chime in with while everyone's getting their questions in. If it's your first time using Zoom, the way that we can help organize some of the questions and answers is, if you're on your desktop, if you look at the bottom bar, there's going to be a black bar and it says Q&A, and you'll be able to ask your questions into that box, and we'll be able to organize as well. But I think a general question that I have, and maybe I'll send it to Josephine first. You've been working in correctional institutions since 2008. And I think so much in the Western world, we see yoga as a studio practice. Can you talk about the importance of why research is important and why evidence-based methodology is important when we're going into correctional facilities, and just the importance of this kind of research?
For us, it's been everything, and especially here in Europe. I mean, it's really, we cannot bring in practices into the prisons over here if we don't have evidence behind it normally, right? If it's going to come in as a daily activity, or if it's going to be an intervention for staff or anything. So to be able to bring this in on a broader level, this research is crucial. So actually, Nora is the one who's been opening the doors for us for all of these years to actually get the first state-funded national yoga program here in Sweden with trained staff in all facilities in Sweden. And that is thanks to Nora's research, and it's fully stately funded, and it's rolling, and it's working in most places, better or worse, but it's still there, you know. So it's been recognized as a how do you say, kind of woo-woos before, like yoga can have this sometimes negative feeling about it out in society. It's like only white skinny women, it's a lot of colors, and we're singing and we're all hippies and everything. Now it's more like a science-based intervention that goes in, that really changes the lives of so many. And inside also our prisons, there are so religious gatherings of people who are coming to our classes. So we can also point to the research. So I'm using the evidence-based, the word evidence-based also for the people I'm serving. When they are skeptical and they're thinking it's a religion or anything, it's like, no, it's a science-based form of yoga. This can be a possible effect, but you know, like it's like it's really supporting our practices over here, and it's really moving it forward and helping us enter other countries as well in Europe and the rest of the world.
That's absolutely incredible to hear. And thank you so much, Nora, for all of your advocacy and your work to be able to pave the path and open these doors. So just reiterating what I heard is that from this research and measurement and evaluation, we're able to start programming at maybe a countrywide level or a statewide level, and then they're funded, which is a big part of Prison Yoga Project. Our goal is to have all programs paid for. That this is rehabilitative. This kind of yoga and mindfulness is supportive for everyone that's impacted by incarceration. And we want to be able to create long-lasting impact. And I think that also is for our facilitators. So our facilitators can be compensated for their work so that the work can continue. So again, thank you both so much.
I think I'd also add really briefly, Blair, that sometimes when we go about starting a new program, it feels like it's offered to folks that are the most general population, essentially, right? It's like, oh yeah, you can do yoga, but do it for low security, or do it for this group, or do it for that group. So I think what's really significant here, as well as folks that may be in the most need, who are often maybe denied community program services because of their illness or because of the crime that's been committed, it's important to know that this group is very deserving and impacted by this programming as well. So I think that's just another significant part of the research. Nora.
And I just want to complete with that one, the future research. Everything what we were speaking here is in adults, these changes. And if you think about that, 10 weeks yoga changes 40 years old or 50 years old criminals or psychiatric patients, then it was, and I think about the neurobiological changes, it was a necessity to go down in ages. So introduce yoga within the juvenile institutions and to introduce within child and adolescent psychiatry, because we want to offer a tool, a self-treatment for children to be able to control their own emotions and behavior instead of being dependent of the healthcare system, for example. And that comes here that it's very, very difficult to come in with this treatment in Sweden to child and adolescent psychiatry. We have started now, we will start next year a randomized clinical trial. We had a lot of interest, like 10, 15 clinics, child and adolescent clinics. Well, yeah, we want to be in this one, we want to do. And when it comes to let's do the research, which is very difficult, actually. It sounds so quick, the results were this and this. it takes 5-6 years to organize this, to collect the data, to have the right data from the beginning to the end. People who are really, we have to acknowledge those nurses or site managers who are working with us, because they are working in their free time. They don't get any extra money to collect the data and follow these kids or patients or inmates for years or many months of the treatment. So my point is that it is difficult. At the end, now we have actually 2 clinics of the 12 who wanted to be, and many of them said, like, okay, it sounds really interesting. We will use this one when you show the evidence that it's working. So it is not easy to be a pioneer. And to collect this, we have 60 patients, maybe 70 now after 2 years. It actually took us our 5 years to do this study and data collection. Okay, there was 2 years COVID as well, when everything closed down. But it is very difficult to get high quality evidence, research evidence. So that's why I'm very proud to be able to fight for this one. But it's not so easy, because you have to have the evidence to come in to these institutions.
Thank you, Nora. I'm hearing just really the commitment that it takes from everyone to be part of our research, and the patients to be able to get the results so that we can share with institutions. So thank you so much. We've got questions coming in with from our community, which is incredible. So we'll keep going. First question, what do you feel is the most common thread you have witnessed in this work? Just curious what you found in this specific realm and population and the intersection with the human experience in general. Thank you so much for your time and dedication to our whole health and healing. I'll pitch it to Josephine.
Yeah. I'm just very struck and I'm very moved every time I talk about this, because I have these human encounters with people that society are viewing as hopeless cases, right? And I see so much strength. I see so much resilience, and I also see so much curiosity and willingness of changing, so that the whole soul is kind of aching for connection and moving together and being seen, So it's like I'm being struck by that kind of human experience, by all of this, behind all of the numbers and everything. And I also see the power of having that regulation skills in your hand when you're moving away from all of these institutions as well. You have real life skills that you can actually use in your everyday life. So that's the most striking experience for me, always coming through these kind of classes and units where I go and visit as well.
Thank you, Josephine. And I think this another question is that ties it with this. Why 10 weeks? Is it so that you can track people's personal experiences? Hopefully I'm not losing everyone.
Both me and Nora can answer this, but for the brain plasticity, we need a certain amount of time for the brain to start changing, so that we can see these changes, and also impulsivity and everything, impulse control. And we have measured with the prison population, and also like normal research, yoga research, we normally do 10, but minimum 10, up to 12, 16 weeks rather. That's to prefer. But we also need to find a formula that's accessible for these environments, because they do shift the people around quite a lot. So 10 weeks, you can keep them there, that you can provide them an effect, a biological change. But then we also really want to make sure in our classes to provide them with these small life skills, right? Regulation skills, so they can use it after. So that's one huge part of our methodology. And with the kids, when we're going to do the research in the child and adolescent care, we're going to have a little shorter intervention, but because of the plasticity it's more plastic, a child's brain. But I mean, Nora, you are the neuroscientist.
Yeah, exactly. We will have 8 weeks. We will have the 8 weeks, once a week treatment in child and adolescent psychiatry. And that's what general research shows. So 2 months is something what you can measure these biological changes, these neurobiological changes in the behavior and in the well-being aspects, what we are doing.
Awesome. Thank you. And I kind of hear, so it's like 8 weeks is the biological kind of standard that we can track changes, and then there's also like an introductory week or an ending week, right? It's like we have a couple extra additional weeks to help orient people. Thank you both so much. Next question. Also, again, thank you both so much for your time and sharing your very important work. Do you actively encourage participants to use portions of the practice outside of class, or is there inquiry by the participants on how to continue when the class is over?
We actually have, this is amazing. I find this every time I think about this, my hairs are standing up, because we have now trained nurses, right, within the forensic psychiatry, where they have in one unit, they have this nurse. When the patient comes and they ask for this, on-demand need medication for anxiety, or not like the necessary medication for depression or schizophrenia or anything, but these kind of add-on layers of maybe unnecessary medication, the nurse is telling them, maybe you can come with me into the yoga room and let's do a few of those practices for anxiety to see how you feel after 5 minutes, if you still want to take that medication. And many of the patients are, okay, I'm feeling better now, actually, so maybe I can wait a little bit with this medication. So it's both encouraged, and it's also, they're using it, like a yoga on a recipe a little bit after the needs, and they learn this inside our trainings, how to work with different kind of symptoms and everything. And also on demand, many of them are asking for give me some practices, can you help me please with this? Or
fantastic. And then I have a question to add in, and I'm sorry if it was spoken to earlier. So the people that went through this 10-week study, is there a continual class available for them now, or was it just the study?
Most of the units have rolling yoga classes already. So it started before the research, actually. So it was initiated before the research, and then we have trained staff as well during the research period. So the intention is for them to continue with the yoga programs inside, because now they have the evidence base. Now it's more easy to get a budget for it. So we do a level 2 training this autumn, actually, to add on some practices and everything. So that's great. Nora?
Yeah, I think it's important to understand that it's continuous. We just needed to stop somewhere to measure what happened after 10 weeks. But these patients can go to yoga for 10 years if they want, So it is not like you have to give 10 weeks to complete the course. It is every section, every week is structured, and then you can do it as many times as you want. And we have evidence that after 10 weeks, you have biological changes. So that's the point.
Thank you, Nora. For our next question, from the mixed group session, did you have a group feedback at the end? If yes, how would you compare the men's responses to the women's responses?
The group feedback is Nora's research.
And this is qualitative research, the interviews, I don't know, honestly. So this is not me who are analyzing the qualitative data, so I have to ask you that we will send you the published data, so it's better if I don't express my opinion about the gender differences.
Thank you, Nora. And then that was the next question is, when do you expect to publish, or when do you expect the peer review process to begin? Either of those questions.
Well, it is published already in January, I think, the main study. So, and I think you have put it, Blair, in the chat box. So it's open access, so you can download. And why we are very proud is that our publication, it's peer reviewed and very high impact factor journal, Psychiatric Research, where it's been accepted. And we publish, it's 4 pages only about the yoga training. So we felt it was partly a validation of the trauma-adapted yoga. So it was very important. So this is already open access. Please go in and download and just digest every page slowly, because it's a heavy article. The qualitative study is hopefully coming this year. and then we spread the links. It will be also open access. We spread the links with PIP. And the female aspect, I would say, give me 1.5, 2 years that I will be able to analyze and make a good hypothesis about this one to be able to publish it.
Thanks, Nora. We'll have you back in a couple of years. Next question, we've got one of our participants leads a program in a small men's jail, and that there are also small-time offenders. Are there any poses to avoid in general?
There are quite a lot. I would recommend to actually do the PYP foundational training to find out a little bit more about this, because it's a vast subject if you're not trained already within the PYP, because I feel, like being trauma informed means we have to kind of really put a few layers of kind of glasses on what can be triggering, especially, sexual looking poses and everything, depending on the reception from the people you have in front of you. So the PYP training is a really good one to take. It gives you all the tools that you need.
I would add as well that outside of the training, when folks become facilitators, we also have guidelines that were created by Josephine that reference a few different poses like happy baby or child's pose, or just rattling a few off here, off straddle, right? So anything that feels like it would be vulnerable in front of a group or in a space where there's officers maybe in the room and participant wouldn't want to do that, it's that, right? Anything that you think, you probably shouldn't. And then over time, certain poses, maybe, I know a lot of people that don't teach downward dog, or they don't teach down dog with youth. I've kind of skipped that with kiddos. And so again, we go much more in depth, but as Josephine said, the vulnerability poses are really avoided. And we're working on some other projects with this work as well to provide to facilitators more resources.
Yes. Thank you, Nicole. And thank you, Josephine, for talking about our foundational training. We also have a 200-hour yoga teacher training that is specifically trauma-informed, that talks about the framework, and we have a lot of people that were maybe studio facilitators that are now coming to facilitate in prisons and jails. And there really definitely is a shift. I think sometimes studio yoga, we might come in with a playlist or an agenda, and so much of trauma-informed yoga or trauma-adaptive yoga is really teaching to the population and teaching to the room, being able to adapt, being able to change, being able to be flexible, all these pieces of yoga and yoga philosophy that we weave into our practice as well. So we have likely in the end of January, we'll have another round of 200-hour yoga teacher training, and our foundational training you can enroll in at any time. Next question. Are other countries adopting trauma adaptive yoga in similar settings as a result of this research?
So we've been leading these trainings, me and Nora, in the world for the hospital settings. So we were invited to sunny upstate medical university 2 years ago, and also this year to train staff. So they are adapting after our method that we have developed for the hospital settings. So some research is going on over there as well, right, Nora?
Yeah, and the Netherlands use institutions, prison institution in the UK. You have the big UK study, male and female prisons that you know better than me. And in the future, we just negotiating. Nicole, you said you work in Vietnam, so that's our next aim, to go and teach pro bono staff who are working with traumatized children, with big children homes, like thousands of kids with trauma. So we are slowly but spreading the knowledge and the evidence about this fantastic treatment possibility and self-help.
Amazing. Thank you. And to anyone on this call currently, or anyone listening at a later date, this is what Prison Yoga Project does. Prison Yoga Project helps you start new programs all around the world. So we are here as a training institute. We are here as a Sangha. We are here as a community. We have all of the infrastructure and resources to be able to help you start a program. So please come to PYP if this is something that if something that you're interested in, whether you have training or not. We will get you to the right place, the right people, and we're always looking to expand our programs. I might have mentioned it earlier. I know that we have over 200 programs around the world. So again, thank you so much for everyone that's part of this community. We have time for a few more questions before we let our incredible guests go and continue their beautiful European summer. Next question. How much psychoeducation do you provide about what is going on psychologically and what the benefits are? Do you provide this before the classes start or at the end of the sessions?
We provide very little, actually, psychoeducation. Hardly any. At some points, we talk about the breath. We talk about some regulation skills, coming into your hands and moving in different ways. But there's just that, again, that layer of too much information. For those who seek psychoeducation and feel ready for it, they can talk to staff and the staff is sharing it. But we don't include it in the classes because we want them to come there and experience their bodies in movement and being in a safe space without necessarily need to kind of switch on that part of the brain that needs to have to take in a lot of information. Because again, there is medication, there is voices, many have voice hallucinations. There is so multiple layers of complexity. So if we add too much theory, we're going to lose them. We need them to move. We need them to be together in this form of a way. And that's what gave these results as well.
Thank you. And I think, just from a PYP perspective, or maybe a yoga-wide, trauma-informed yoga-wide perspective, so much of us are living from the neck up. And what we're wanting to do through our trauma-informed yoga classes is bringing people back into the body. So staying away from heady information or information that might just be more confusing for people, bringing them back to the body. How can we continue to bring people back to the body? And again, Nicole mentioned this earlier, but working with our window of tolerance, right? We might see people dissociating in class, very normal for facilitators, normal for people in regular yoga as well. So we're working with people's windows of tolerance to bring them back into their bodies. Again, thank you so much. Yeah.
And I can add one layer there that so many of the people we meet, they feel out of sync. It's like a little bit out of sync in their social interactions, in like how they interact with themselves and everything. And that possibility of syncing up with people, feeling like you're a part of a community without you need to use your words. You can actually just sink into that experience without having that pressure on you that you have to verbalize anything. So.
And I would just like to add, for general population classes, we do in some states provide a curriculum. So there are programming where folks do have access to a workbook that does go into psychoeducation. The longer I'm with my groups, the more we do talk about the sympathetic and parasympathetic system. But as Josephine said, you don't want to take people and Blair out of the body. And there's a really fine balance between movement and lecturing, right? We don't really want to lecture in that way, but there are resources that exist, such as Josephine's book. We call it, that's my code, Josephine's book, but, and the book that James wrote. So both Yoga for Women and Yoga for Men that are incarcerated, that folks can write to us and get a free copy of, that goes a little bit more in depth into some of this psychoeducation.
Thank you so much for pulling that in, Nicole. I'm going to drop a couple links in the chat and then a couple links for anyone who's listening in the future. And then I want to pass it to you, Nicole, if there's any other questions that we might have for our community today, and then we'll start to wrap it up.
Yeah, I have just a question for y'all. With your upcoming work with youth, as a former educator, as someone who has worked in youth prisons, I play a lot with them. We play. And so I can understand not wanting to get those teenagers too aroused, right, and out of control. However, I didn't know if there's going to be any aspect of play in the yoga that you're doing with them.
We've been having stuff rolling around, doing stories. There's a lot of playfulness. Also to, get the inspiration going. We also use music at points in the class sometimes, so it's much more playful, of course, to get them into these environments.
That's really exciting to hear. Everybody who's talked to me about our work knows I play Yogi Says all the time with participants, which is just, if you're not familiar, it's like Simon Says, but Yogi Says. And you invite folks to do poses and things. And actually, it's been requested by the adults that I work with pretty regularly. So on any given Tuesday, there may be 80 men at a time playing Yogi Says. So I think play is a really important aspect too of what we do that we don't talk about very often. So that's exciting to know that that is going to be a piece of that. And I can't even imagine staff rolling around on the floor. That's hilarious and awesome. I'm curious, Blair, I feel like, I just wanted to make sure with the chats coming in that there weren't any. Okay, just making sure we weren't missing any questions. But if y'all each could leave the group with one big thing, right? One big thing that you want them to take away or bring with them, what is it? Right? And it can be a lot of things.
I can maybe share that never underestimate your presence. That if you're interested in going into these facilities, your intention and just being there, sharing these moments with so many people is just so powerful that it's not about us being there teaching them anything. It's just by that, common experience that we share with each other. So you are a very important piece of this if you're interested in doing this work. So it's very powerful, actually. And we learn as much as anybody. So my own mental health has improved a lot by working with these people. So it's like always an exchange, right? So it's not us teaching or treating them. It's always an interaction. So,
Josephine. Nora?
For me, from the science perspective, I'm thinking that it is very important that you feel self-confident, even if you are against the stream, because the society, it's very difficult to find our place with these natural treatments, to come back to the body, to work with the body when our society moved quite a lot for medical or pharmacological treatment of both psychiatric and somatic complaints. So it is very difficult to come in again and working with giving back the powers to the people and working with your own body instead of taking quick release medication, which takes away your power. So all of you who are working with yoga and helping people to give them back the power, I know that it can be difficult. So I just want to strengthen your beliefs in this one, that you are doing something very important, and for supporting us as well, the research, which will give the possibility to, if even we cannot change the whole society, but at least find a stable place in the society for this non-pharmacological treatment, which empowers people.
Thank you both so much for these incredible words to leave us on. And I really like, Nora, your encouragement to keep going, just really in the root of the empowerment of our work, both as facilitators and participants. So thank you again, Nicole, also our incredible executive director, for leading this conversation. Again, we wouldn't be able to be here without our community, who really is the bedrock, our facilitators who are going in maybe daily, maybe weekly, to be able to offer yoga and mindfulness in a trauma-informed framework to people that are impacted by incarceration. Again, thank you all so much for being here. We are PYP, and we'll see you next time.